about extrapulmonary forms of tuberculosis. All localization of a specific process outside the chest. You can see this picture, forms of tuberculosis and the percent. Basic principles for diagnosing tuberculosis is application of research method to the patient and the accumulation of the information received. Analysis of the information received in terms of reliability and specifically. Construction of a diagnostic symptom complex. The formulation of a preliminary diagnostic or a number of disease. Differential diagnosis. Formulation a clinical diagnosis in a detailed form. Verification of the corrections, disease, and the treatment. Specific on the basis of a data, the diagnostic was made. Complaints and what it include. Contact with a patient with tuberculosis, history of the disease, history of life, functional research. Laboratory studies, detection of MBT, change in the hemogram characteristic of tuberculosis, positive reaction to the tuberculin or Diaskin test, the presence or absence the scare after BCG on the left shoulder, endoscopy, cytological and histological examination of biopsy, specific X-ray examination. Most often, extrapulmonary tuberculosis is located in kidney, eyes, skin, bones and joint, lymph nodes, and so on, and other organs. You can see at this picture tuberculosis of the parenchyma of the kidney, path of infiltration. General symptoms is general intoxication, hematuria, leukocyturia, proteinuria, back pain symptom, dysuria, and paranephritis. It is important. Complaints is general weakness, malaise, weakness, pain in the lumbar region, dysuria or dysuric pneumonia. Analysis of life, disease, epidemiological analysis, long-term urological history. Laboratory research method, clinical blood test, urine culture for microflora, or Diaskin test. Method of radiation diagnostic is X-ray of the chest, plain urogram, urography with contrast, ultrasound, hypoecho formation, and so on. You can see this picture, what help us of radiation diagnostic. It is urogram. We can see at this picture surgical preparation of the kidney for fibrosa, cavernosa tuberculosis of the left kidney and tuberculosis of the left ureter. Outcomes of the tuberculosis process of the urinary system: pyelonephritis, chalky kidney, microcystitis, tuberculosis pyelonephritis, and so on. Risk group for tuberculosis of the urinary system: chronic pyelonephritis, chronic cystitis, tuberculosis of the female genital organ. It can be tuberculosis of the vulva, of the cervix, of the endometrium, and we can see at this picture structure of genital tuberculosis. The first place is occupied by damage to the fallopian tubes, the second to the endometrium, the ovaries and cervixes, and it can be tuberculosis of the vagina, and external genitalia is very rare. Clinical picture. The first symptom of the disease may appear already during puberty, but the main contingent of patients with genital tuberculosis are women 20-30 years old. In rare cases, the disease occurs at a later age and even in postmenopause. At this picture, you can see tuberculosis of the female genital organ and clinical picture of this disease, and what we can do with diagnostic of this disease. And it may be tuberculosis of the male genital organ, and you can see at this picture what it includes. It can be tuberculosis of the penis or prostate gland, and so on. Tuberculosis of bones and joint, clinical picture include symptom of intoxication, feeling in heaviness in the spine, instability of the lump to limit movement, lameness, and it can be pain in the spine, and so on. Diagnostic, it can be radiography of the affected skeletal region, tomography, computer tomography, MRI, bacterial research, cytological examination, histological examination of the material. You can see this picture, tuberculosis of the bones and joints. It can be tuberculosis of bones and joint in children. Clinical picture in younger children is general clinical symptoms of the disease predominate, change in behavior, loss of appetite, physical activity, and evening subferal condition. In older children is local symptoms of the disease. It can be back pain, change in gait, posture. Treatment of tuberculosis of bone and joint is surgical method, bone resection, amputation, implantation, or metal structure. Tuberculosis lymph nodes. Clinical picture of tuberculosis of peripheral lymph nodes. With an infiltration form, the course is more favorable, limited process predominate, the size of the lymph nodes is small, the symptom of intoxication and moderately expression. And you can see that with the inductive form, the course is more favorable. Lymph nodes do not reach large size and are not prone to fusion. Pathological characteristic is period of primary infection is characterized by the presence of massive caseosis in the lymph nodes or form fistula. The secondary change, tubercular, low severity of perifocal and caseosis lesions. You can see this picture morphological change in lymph nodes and its classification. Tuberculosis of lymph nodes. And what help us diagnosing of tuberculosis of lymph nodes? Is history, it may be contact with a person or animal with tuberculosis, the state of the lymph nodes, the consistent symptom of intoxication, X-ray examination, ultrasound, computer tomography, MRI, histological examination, lymphography, bacteriological examination. And you can see algorithm for diagnosing tuberculosis of lymph nodes. Verification, and so on. Differential diagnosis of TPLU and regional post-vesication lymphadenitis. Associated with BCG vaccination, localization in the left axillary, lack of indication of contact with a patient with tuberculosis, the absence of change in tuberculosis nature from other organ and system. Post-vacation axillary lymphadenitis. Surgical finding in case is tuberculosis of the peritoneum, acute intestinal obstruction, perforation, and bleeding. Clinical picture is low-grade fever, diarrhea, pain in the umbilical, right iliac region, specifically in children. Chronic sepsis from months to year, often diagnosis with acute mesodynitis. Clinical mask of tuberculosis is colitis, chronic cholecystitis, gastroduodenitis, appendicitis, mesodynitis, tumor, and so on. Let's try to explain tuberculosis of the skin. And you can see this picture form of skin tuberculosis and what we can do with diagnostic tuberculosis of the skin. You can see this picture apply jelly symptom, apple jelly symptom of the skin. It's look like butterfly. Eyes tuberculosis is granulomatosis disease resulting from the hematogenic introduction of Mycobacterium tuberculosis into the vascular tract of the eye. The mechanism of development of tuberculosis of the eyes is ambiguous. There are three main pathogenical forms. You can see and write this. Relative localization of granuloma and retinal veins. Classification is tuberculosis hematogenic uveitis, and it can be iritis, cystitis, keratouveitis, and so on. Tuberculosis iridocyclitis, tuberculosis peripheral uveitis, central bacterial tuberculosis chorioadenitis, comprehensive clinical diagnostics is targeted history talking, assessment of the clinical picture, immunodiagnostic, tuberculin diagnostic, trial treatment of anti-TB drugs, inclusion of other chronic eye disease. Thank you for attention.